Well, the World Health Organization says the coronavirus pandemic has exposed extreme inequalities in the global health system that favours rich countries. The WHO has renewed a call for more funding so vaccines against COVID-19 can be widely distributed in the most vulnerable communities. The International Monetary Fund has also floated the idea of a temporary solidarity tax to force businesses that have cashed in on the pandemic to share their profits. Paolo Montecillo reports.
The development, production, and distribution of coronavirus vaccines is ramping up around the world. For instance, Cuba is in late-stage trials for 2 homegrown jabs. In Germany, a factory owned by BioNTech is quadrupling its output to 1 billion doses a year. And the UK has started its distribution of shots developed by American firm Moderna.
I feel happy. Yeah, I do. I feel really thrilled, really happy. I feel honored in a way.
These inoculations are the primary weapons against the biggest global health crisis in a century. But nearly 90% of vaccines have gone to rich countries. Poor nations have received just 0.1% of the vaccines produced worldwide.
The pandemic has highlighted the lack of investment in public systems, and in particular in health systems. The pandemic has shown the fact that the victims, especially the people who died, were among the most vulnerable groups.
The World Health Organization says dozens of countries are ready to start distributing vaccines, but have been unable to because of supply issues. And the UN agency's vaccine distribution program, known as COVAX, remains severely underfunded.
WHO will continue to call on governments to share vaccine doses and fill the $22.1 billion gap in the ACT Accelerator for the equitable distribution of vaccines, rapid tests, and therapeutics.
To help fill that gap, the International Monetary Fund is proposing a tax for companies that have seen profits rise during the pandemic. A so-called solidarity tax would be temporary to aid countries struggling to manage the economic effects of the pandemic.
We've learned that fiscal policy is powerful and that sound public finances are crucial in order to enable that power to be used to the fullest.
Meanwhile, Moderna has already started trials for a new inoculation designed for more contagious strains of COVID-19. It's a reminder that even as nations prepare for life after the current pandemic, the next major health crisis could be right around the corner. Paolo Montecillo, TRT World.
Let's get more on this now with Dr. Margeret Harris in Geneva. She's a spokesperson at the World Health Organization. Lovely to have you back on the program, Doctor. But can I start by asking you first about the European Medicines Agency's latest findings that there is a link between the AstraZeneca vaccine and the incidence of blood clots. Last month, the World Health Organization said that the injection was still safe to use. Has that thinking changed?
So our Global Advisory Committee on Vaccine Safety has also looked at the data that the European Medicines Agency reviewed, plus the data from the United Kingdom and other parts of the world. And their finding was that the link is plausible but not confirmed. And at this stage, we are indeed saying that the benefits of the vaccine, and the benefits are very great, they're bringing down deaths and disease, outweigh the risks, but it is very important for people to know that there are potential adverse effects, and if they get any signs or symptoms of those adverse effects, that they immediately contact their medical advisors.
What do you make then of the UK's decision to abruptly change its guidance on the use of the AstraZeneca vaccine, saying that under 30s will be offered an alternative injection, either the Moderna or the Pfizer one? Do you think that other countries should follow suit, given what we know about the link between blood clots and that injection?
So the United Kingdom has made a careful risk assessment based on their epidemiology and the age structure of their population and also the availability of vaccines. And they have made a decision that for people under 30, the risks from COVID are not very high. So therefore, they've advised that people under 30 have a different vaccine.
Okay, and today you are joining us on World Health Day, and the theme that the World Health Organization has set is a fairer, healthier world. Now, we know that during this pandemic, from the distribution of protective gear to the rollout of treatments and now the vaccines across the globe, it really has sharpened that divide between the haves and the have-nots. Tell us more about how the pandemic has exposed those inequities in the global health system.
Well, you've outlined several of them already, but it's also important to look within countries. People who haven't had access to good healthcare or haven't had access at all were coming to hospitals or healthcare late, so therefore they were more likely to have severe illness or even die, or some people never even reached the hospitals. Other people who've not had access to preventive healthcare have got serious underlying disease, sometimes not even diagnosed, and we know that the people who've got the severe underlying disease are again more likely to get severe COVID and again more likely to die. So if you've not been able to access good healthcare, and if you've had the other inequities of life, if you've not had access to work, if you've not had access to good housing, if you live in very crowded conditions, if you're breathing very, very polluted air, if all these things are affecting you, they're having a greater impact on your health than somebody else who's got better access to health, lives in more comfortable housing, has better finance. So just at community and society level, we're seeing this in every country, whether that's a wealthy country or not. But indeed, certainly with vaccine distribution, we are seeing that the wealthier, the more resourced countries certainly have got far more access to the vaccines than the less resourced countries.
Now, to address the divide between those countries that can afford to vaccinate their populations and those that cannot, the World Health Organization is leading the COVAX initiative. Can you just update us on that progress? Are you happy with how wealthier countries and drug companies have really stepped up to the plate to help those countries in need?
Well, certainly COVAX is something that has never happened before, but almost a year to this day, we realized that we were going to need something like this to ensure that there would be equitable distribution, not just of vaccines. We actually set up something called Act Accelerator to distribute all the things needed to treat COVID, the oxygen, any drugs that worked, the tests, the other equipment, and COVAX was the arm for delivering vaccines. It had a slow start initially, but yes, indeed, many manufacturers did come to the party. We've had provision of vaccines with several of the manufacturers went into advanced commitments, early commitments to provide doses. Many of the wealthier countries came in and certainly provided finance, and Europe very much led the charge on this idea and very much led the advocacy and the commitment to bringing the world together to do this. Now, when it came to the pointy end, actually getting those vaccines out, that was more difficult. It has been difficult to get the supply. We're delivered to close on 100 countries, so that's good, but we want to be able to deliver to every country, ensure that every country is vaccinating its most vulnerable populations.
Okay, Dr. Margeret Harris from the World Health Organization. We will have to leave it there, but thank you again for joining us on the program.